So now, that's Down syndrome. So why is Dr. Boni teaching Down syndrome? We are teaching Down syndrome because it is stated in the objective. Simple. I always say this. If it is not in the objective, don't learn it. If it is an objective, master it with all your heart. And that is why people are mastering and people are acing this QE1 because they are taking that advice, right? Okay, good. So let's start with Down syndrome. The first thing is that we're going to learn how to pick up clinical features of a patient with Down syndrome. Very important. Very, very important. And we're going to do that with a question and answer format. So I want somebody to raise their hand, volunteer, and read the question in the metcognito way. Okay, Dr. Michael, let's go. Please unmute and let's go.
A newborn presents with obstructive palpebral fissures, a flat facial profile, and a protruding tongue. The infant also exhibits hypotonia and a single transverse palmar crease. Which congenital heart defect is most likely to be present in this patient? A, atrial septal defect, B, ventricular septal defect, C, tetralogy of Fallot, D, complete atrioventricular septal defect.
Beautiful. What is the answer? Those on Facebook, those on Zoom, is it A, atrial septal defect, B, ventricular septal defect, C, tetralogy of Fallot, or D, complete atrioventricular septal defect? Dr. Jagdeep Sharma went for A. I see that there's a controversy in the Zoom. iPhone went for A, but Dr. Sadaf decided to differ and go for D. Dr. Noor also went for D. And what is the correct answer? What is the correct answer? It looks like there's a competition between A and D. What's the correct answer? The correct answer is D. 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 What is the commonest cardiovascular congenital heart defect in patients with Down syndrome? It is complete atrioventricular septal defect, CAVSD. Doctors, please, this is very critical. What is the commonest congenital heart defect in children or in patients with Down syndrome? It is complete atrioventricular septal defect. Complete atrioventricular septal defect is the most common congenital heart defect in infants with Down syndrome. It's seen in 37% of the patients, okay? That is complete atrioventricular septal defect. It is seen in 37% of the patients. Now, although ASD is common, it is less frequent than CAVSD. And although VSD is also common, but it is not as frequent as complete atrioventricular septal defect. And although tetralogy of Fallot is seen, but usually it is seen in a very, very little number of patients who present with Down syndrome. So this is the first catch. So if you sleep and somebody wakes you up, what is the commonest congenital heart defect in children with Down syndrome? It should be complete atrioventricular septal defect. Doctors, that's a huge learning point there. Okay, let's go to the next one. Who wants to read for us, please?
Yeah.
Who wants to read for us? Okay.
Yeah, I can read it. Sorry. A 6-year-old child with Down syndrome presents with a history of recurrent respiratory infections and obstructive sleep apnea. Physical examination reveals low stats ears and then protruding tongue. Question: what is the most likely cause of recurrent respiratory infection in this child?
Good.
A is asthma. B is chronic aspiration. C is immunodeficiency. D is upper airway abnormalities.
Okay. So now the jury is out. What is your answer, class? Everyone should type their answer. And thank you very much, Dr. Franklin, for reading that question for us. Is it asthma? What is the most likely cause of recurrent respiratory infections in a child or in an adult with Down syndrome? We've looked at cardiovascular issues, the most common. And whenever you are learning, you have to learn the most common stuff. Now we are looking at somebody with recurrent chest infections. Recurrent chest infections. What is the most common respiratory concern there? So, what is the answer? Okay, good. I'm very happy. Dr. Mundis, oh, my friend, Dr. Mundis, and Dr. Michael, people are getting it right today. What are you people reading? Dr. Michael, what are you reading? It looks like you're getting all the correct answers today.
I'm reading the main stuff.
What?
Medical. I'm reading the main stuff. Med-cognito stuff.
You are reading the med-cognito stuff. Great. So this is in your notes. What?
In med bullets.
It's in med bullets. I see. Okay, I've even forgotten all that I put in the med bullets. Awesome. So look, this is it. So upper airway abnormalities, correct. Children with Down syndrome often have structural upper airway abnormalities that contribute to recurrent respiratory infections and obstructive sleep apnea. Simple. By the end of today's class, you don't even need to review Down syndrome anymore because we are reviewing everything. So look, children with Down syndrome often have structural upper airway abnormalities that contribute to recurrent respiratory infections and obstructive sleep apnea. Okay. Now, other answers which were wrong. Asthma is common in patients with Down syndrome, but is less likely to be the primary cause of recurrent infections. That's the first thing you have to understand. Number two, chronic aspiration is possible, but is less likely or less common than airway abnormalities. And then immune deficiency can contribute, but structural abnormalities are more frequent. So that is the other thing. In MedCognito, when you do a mock or something, we provide explanation. However, the explanations are straight to the point, and they are teaching points, right? So today, what is the commonest cardiovascular complication, structural complication we see in patients with Down syndrome? Who can remind me, please? Who can remind me? Cardiovascular.
Complete atrioventricular septal defect.
Beautiful. Now, why do they get recurrent chest infections?
Upper airway
abnormality.
Upper airway abnormality. Next question. An adolescent with Down syndrome is evaluated for behavioral issues. He has been increasingly aggressive and has episodes of depression. Which psychiatric disorder is most likely commonly associated with Down syndrome? So what we are doing is that we are picking systems, right? We are picking systems and we are looking at common presentations in these systems. We do that cardiovascular, we looked at respiratory. Now let's look at psychiatry. Which psychiatric disorder is most commonly associated with Down syndrome in adolescents and even adults? A, schizophrenia. B, major depressive illness. C, bipolar disorder. D, autism. The well-trained doctor knows. But today, we're going to demystify everything. You guys, looks like you're getting everything right today. Dr. Jagdeep, you should see the answers they are giving to us on Zoom. They are all saying B. You are going for D on Facebook. And the answer is, in fact, B. Guys, what did you read today? This is interesting. I'm very happy. That means that we are mastering the concepts, right? People, and that is what I want to see in the IMG community. People are doing focused learning. So, major depressive illness is one of the most common psychiatric disorders in adolescents and adults with Down syndrome. Now, is schizophrenia very common in Down syndrome? It is less common. Bipolar is less frequently diagnosed. Autism is common, but it is common in children. When it gets to the adult spectrum, the most common psychiatric condition is depression and major depressive illness. Okay, so let's go on to the next one. Who will read this one for us? This one, I want somebody to read for us. I need a volunteer.
Dr. Bruni, can I read?
Yes, please. Why not? Please read for us.
A 2-year-old with Down syndrome is noted to have macrocytosis and thrombocytosis on a routine blood test. He is asymptomatic. Which condition should be monitored in this child? Option A, anemia. B, leukemia. C, thalassemia. D, sickle cell disease.
Beautiful. You read it so wonderfully. So, what should be the answer? Guys, this is awesome. This is nice to see. So, the answer is leukemia. Leukemia. Children with Down syndrome at increased risk of developing leukemia, particularly. So now we are learning that they are likely to develop. Leukemia is the hematologic complication you want to be concerned about. And what kind of leukemia are you concerned about? Like the transient myeloproliferative disorders and acute megakaryoblast leukemia as well. Okay, ALL is also common. So anemia is common, but not directly linked to macrocytosis and thrombocytosis, right? And then thalassemia is less likely in the context of Down syndrome. And sickle cell is unrelated to Down syndrome. Doctors, so you see the way we are trying to map things: hematologic, then we learn cardiovascular, and then we learn respirology, then we learn, mental health concerns, then we learn. Now, I want us to try this, then we do a CDM. I want us to try this, then we do a CDM. Now, this question is, a 40-year-old woman with Down syndrome presents for a routine checkup. She has no significant medical history and lives independently with some assistance. Which health condition is she at increased risk for developing in her 5th decade of life? In her 5th decade of life. So you realize that now Down syndrome just goes beyond palpable fissure, single palmar crease, hypotonia. We are learning deep stuff, deep stuff, which will help us to really, really master this whenever we meet any exam situation. So we are learning deep stuff. So the question is this: which health condition is she at increased risk for developing in the 5th decade? Is it A, Parkinson's disease, B, Alzheimer's disease, C, multiple sclerosis, D, Huntington's disease? Which of them? I've gotten 17 answers on Zoom already. Okay, today I'm very glad. So the answer is Alzheimer's. Alzheimer's. Adults with Down syndrome usually develop neuropathologic and functional changes typical of Alzheimer's disease by the 6th decade of life. So Alzheimer's disease is more common in patients who develop Down syndrome, especially as they grow up, by the 6th decade of life. That is what is going on in their life. So Parkinson's disease is less common in Down syndrome when compared to Alzheimer's. Multiple sclerosis is not associated with Down syndrome. Huntington's disease is a genetic disorder and it is unrelated to Down syndrome. Okay,